this sets the context for our conversation today. Let me just put down my phone. So I think it's really important for this session to set the context. So we're talking about public health in the context of true cost accounting of American food. So what does that mean? True cost accounting in relation to health is vast and complex. So we're talking about all health impacts produced by food and agriculture systems, and we're talking about negative and positive health impacts. So you heard many of them this morning, particularly on the negative side. I'm not going to go over the numbers because you've heard many of them this morning, but let's just look generally at kind of the map or the picture of what this means. We've got diet-related diseases, non-communicable diseases. That includes diabetes. The American Diabetes Association estimates the cost at $245 billion in the U.S. in 2012. Obesity, you've heard about that. Heart disease and stroke. Amazing information from Tyler Norris on reproductive health and the human genome, which is just astounding. I have heard from the FAO that there's increasing connection between the irradiation of food and celiac disease. And this is just a massive and daunting area. We've also had health impacts for farm workers, and we heard about the Chamaco study that Tyler Norris talked about this morning. I mean, again, astounding numbers where folks in one valley in California have 59% increased chance of leukemia, 70% increased chance of stomach cancer, 63% increase in cervical cancer. I mean, these are crazy numbers. Thirdly, we have atmospheric pollution. So we've got global greenhouse gas emissions. Jonathan Foley pegged that this morning at 25 to 35%. We've got nitrates in drinking water, air pollution causing respiratory diseases like asthma, allergies, etc. There's stuff on the positive side of the ledger too. We can't forget that there are positive externalities to these systems. And we need to take those into account, not just in a notional sense of taking them into account, like considering them, but we actually have to take those into our accounts, as in our financial accounts. And here we have things like the reduced healthcare costs, kids eating fresh fruits and vegetables. We have things like the nutritional benefits of traditional foods in many communities throughout the globe. And we have things like the cultural value of breaking bread together in your community. So, just in a brief, couple of minutes, you can see this is a hugely vast area, if not daunting. Where it's at. This is what we need to be talking about. It's really about the health of our communities, the health of our children, health of our families, the health of the planet, the health of the animals. So we have an hour and a half to dive into this with some competing noise, so hopefully you'll be able to hear everything. We really can't do this subject justice at all, but we would like to scratch the surface today. We would like to open the door a crack to kind of see what are we talking about, why it's important, and maybe some of the things we can do about it. So the way we're going to do this is we have 4 panelists here behind me. I'm going to introduce them in a second. They'll each speak for about 7 to 9 minutes. I've got a few questions for them as well, which I'll pose to them afterwards, and then we're going to open it up to a Q&A so you all have time to ask questions, make comments, etc. So they're each going to address what are we talking about, why should we care, and what are we going to do about it, each with slightly different emphasis, with the hope that we all leave from this session better informed, perhaps a little outraged, with a better sense of what we do and where we go from here. So first of all, I would like to introduce Judy Hatcher, who's with the Pesticide Action Network. And in our opening interview when we were speaking about this session, Judy spoke very articulately about the why we care question. She sees a lot of impacts in her community and does a lot of work with families, children, and communities. So really pleased to have Judy with us. We've got Pete Myers here with the Environmental Health Sciences. Pete has been, I think, one of the most outspoken and focused advocates on endocrine disruptors. And I mean, vast knowledge, amazing amount of passion for this. So really welcome, Pete. Sorry, thank you. We've got Richard Jackson here with the University of California, Los Angeles. And I have heard, I've never met Dick, we don't know each other, but I have heard by reputation that he's just got an incredible passion for trying to change the system and thinking very politically and strategically about what that might look like. So we're really happy to have Dick here. And Robert Martin with the Center for Livable Futures. Bob has been in government, and he's played an incredibly important role here in the U.S. Around meats and antibiotics. So we've got a fantastic panel. We have specific expertise on the pesticides and meat and antibiotics front, but I wanted to paint the broader context just so we keep that in mind. So what we'd like to do is sort of talk about why we care. We're going to do 2 case studies on endocrine disruptors and antibiotics, and then we're going to talk about strategies for change. So with that, I am going to turn it over to Judy, and this is the best mic, so I'm going to pass it over to her.
Thank you. Can you hear me? I feel a little bit like a rock star here. You know, you'd sort of like... So speaking of rock stars, it's really an honor to be on this panel with these folks. And I'm sort of intimidated by the people who are in the room who've been doing this work for decades. It's not just preaching to the choir. I'm preaching to a few preachers as well. So bear with me here as I do a little bit of the context setting. As we talk about and think about what we're learning at this conference, we want to remember that the real costs of the food system are widespread and interconnected, and that the negative impacts, as is true with most issues in society, fall the hardest on the people with the least amount of power, influence, or money in society. And I'm going to start here with, this is going to go. And so to begin with, farm workers and rural communities bear disproportionate exposure to agricultural chemicals near the beginning of the food chain. Farm workers breathe in or absorb harmful chemicals through their skin while they mix or apply pesticides, or while planting, weeding, and otherwise working in the fields. Many studies have documented the elevated risk to farm workers of chronic diseases linked to pesticides, including cancer, birth defects, and learning disabilities. Living near the fields, their families are also affected by this. For example, pesticides that are carried home from the fields on workers' skin and clothing puts their children at risk as well. We're generally all affected by contaminated water, air, and soil. It's no question about it. People in agricultural communities are much more likely to bear those burdens. Here's a photo of one of the farmers we work with in Iowa, who is learning to use our drift catcher monitoring tool. Neighbors in small communities of Waimea on the Hawaiian island of Kauai say that they've been living for years under a coating of pesticides. I mean, just they can't open their windows and doors because there's so much drift in the air. And that drift, of course, goes to the soil and into the water. It's just the whole system is poisoned. This is because they are living downwind or next door in some cases to Dow Pioneer's experimental GE crops, genetically engineered crops, where they can test chemicals on cornfields 3-4 times a year because of the beautiful weather. So what's happening then is that these genetically engineered seeds that are used and grown in Iowa are actually tested in Hawaii. So it's a really big system, and people on either end of the system are really suffering. The seeds grown in they practice on in Kauai, they have to use at 18 tons of restricted pesticides in a single year, just in one part of one island in Hawaii. So imagine what that must be like for that community and people's health and the environment. And I'm sorry, I'm going to read so I can kind of stay on time and not drift. Like the pesticides. I'm a benign drift, okay? So, thank you. Atrazine, one of the most widely used herbicides in the United States and found in 94% of all of our drinking water tested by the USDA, is a potent endocrine disruptor. And even low levels of that may interfere with the healthy fetal development, among other concerns. Water utilities around the Midwest have to pay millions of dollars to process the water so that it could be supposedly safe to drink. It's led to a big class action suit against Syngenta, which was successful, but it was only a drop in the bucket, sort of a pun intended, toward both past and future public health costs of so much atrazine in our water. Additionally, communities in unincorporated areas and people who rely on well water are at a higher risk of exposure to contaminated drinking water, particularly nitrates, which are a very real and serious concern. Because of the widespread nature of contamination in the San Joaquin Valley, many residents spend extra money to buy water. For example, in a small town of Seville in Tulare County, the elementary school spends thousands of dollars every year on bottled water for the children to drink because the water is not safe. The average annual income in Seville is approximately $14,000 a year. The EPA has established a criteria for determining what is an affordable household cost for water. It considers spending over 2% of your annual income to be unaffordable. The Community Water Center, which was here somewhere, calculates that many residents throughout the valley spend up to 10% of their income on drinking water, as well as paying, for the water that comes to their home. So although they're far from farm communities, indigenous people north of the Arctic Circle in Alaska have a high body burden of persistent organic pollutants. These are among the poorest people in the country, and they rely on traditional foods, fish and marine mammals, for most of their calories. Those fish and mammals are filled with PCBs, mercury, and other pollutants, including pesticides. So these isolated and impoverished communities are paying the cost of our choices here for food that they're not even eating, and that's grown a very long distance away. And they have unusually high levels of cancers, reproductive problems, thyroid disease, and other impacts. Again, as consumers, we're all affected by pesticide residues. Glyphosate, the active ingredient in Monsanto's Roundup and a probable carcinogen, is one of the most prevalent pesticides in our food. A Reuters study found that it's in our honey, soy sauce, flour, infant formula, and breast milk, for example. People in lower income communities may be understandably reluctant to put their limited dollars into organic food or food that is seeming safer. And while there is much more fresh food and pesticide-free food that's available, it's not so much available in small communities, in rural communities, and poor communities. How we transport our food, sometimes for long distances, also has real and negative impacts on the health of communities near major ports and other commercial transportation hubs, where emissions from heavy traffic, especially exhaust from diesel trucks, contribute to particulate matter that can increase the incidence of asthma, for example. Diesel exhaust is classified as a carcinogen in California. It contains 40 of the hazardous air pollutants listed by the EPA. We would need an entire session to dive into any of these issues. We didn't talk at all about the folks that make pesticides and what happens, as we've had a couple years ago in Texas, when there is an incident where there's an explosion at a pesticide plant. I mean, it goes on, this reliance on chemical inputs. And there's much, we could have a whole day on the public health impacts of greenhouse gas. And again, the way that we grow our food is a major contributor to greenhouse gas. So just to close, a couple of things here. Children are especially vulnerable. Preventable environmental hazards cost California $254 million every year, and $10 to $13 billion over the lifetime of all children born every year. Asthma has the greatest financial impact on an annual basis, costing families and the state over $208 million every year. And pesticides, which are very heavily used in California, are one of those major impacts. In California, the environment contributes 30% of the childhood asthma burden and 15% of the childhood cancer burden. The report, The Cost of Environmental Health Conditions in California Children, estimates that 15% of childhood cancer cases could be prevented by substantially reducing children and expectant parents' exposure to environmental hazards, including pesticides, saving $19 million per year and $33 million over the lifetime of children born each year. How am I doing on time?
30 seconds.
Okay. So I'm going to say just at the end here that there is much that we can do. I've heard a lot this morning about equity and what it means to have diversity and equity in this conversation. And I think it's important that we do not accept the notion that some communities can be sacrifice zones so that we can grow the food that we want to grow as cheaply as we want to grow them. And we can't accept the notion that some people's health outcomes are less important than other people's health outcomes so that we can have what we want at the way that we want to have it. That means that we need authentic partnerships, not tokens, not sprinkles of diversity, but authentic partnerships. And you can't have those if those people are not in the room from the very beginning. And that one example was one that we heard this morning in the panel that was not named, but both Whole Foods and Bon Appetit are part of the Equitable Food Initiative, which is trying to be a real partnership between farm workers, farmers, retailers, and others to really have a systemic approach to change. And my last slide is when I think about this work, and it's very difficult and depressing sometimes. This is my brother Wayne, my sister-in-law, and their 2 kids. Ada, one with a little hat, had her 4th birthday on Monday. And these are, working class folks, a teacher, and she works in a bank. They're already health conscious, but since they've been having kids, they're really serious about what are they feeding their kids? How do they go about this? People like this, they need tools. They want it to work, but they really need a systemic approach, not just all on their own initiative. So with that, I will stop.
Thank you very much, Judy. That's great. So now we're going to hear from Pete about endocrine disruptors.
Great, thank you. It's a pleasure to be here with this distinguished panel and to have all of you here to listen for 8 minutes about a subject I've spent a lot of my adult life on. Endocrine disruption is about how chemicals interfere with hormone signaling. It happens at extremely low doses, and it can have profound effects. These are some of the health conditions that are associated with the consequences of endocrine disruption by chemicals particularly affecting development, but not just development, also adult health. The World Health Organization 2 years ago declared endocrine disruption a global public health threat. This is not trivial. This is a big deal. And I could go on at length about that. But now I want to put it in the context of the food system. Think about what we heard mentioned this morning, from field to fork. If you think about all the multiple steps that a food product goes through, from the original application of the pesticides, herbicides, or whatever on the fields, through the processing of the material, to the manipulation during all the things that those companies do wonderfully to create the food that you can eat, to cooking at your home, to delivering it on utensils. Each one of those steps creates the opportunity for chemicals inadvertently to enter into the food system. And I should highlight food packaging material, which as you begin to learn about the migration of packaging material into food, you realize this is truly a horror. I won't say any more about that right now. But so you've got this sense of a system and multiple pathways by which chemicals can enter into the food system. We have tried to ask the question, what are the economic burdens imposed by endocrine disruption on the health system? And we did that specifically in Europe, because today in Europe there's a big argument underway on how do you define endocrine disruption. Could it be this way, could it be that way? And part of the argument from industry has been, well, we're going to lose jobs. We're going to lose profit. So we decided we would ask, how much money is the healthcare system paying, healthcare system and more broadly socially, are we paying for the health consequences of that exposure? I know there's a way to advance this. Enter. There. So we published this a year ago in a journal published by the Endocrine Society, which is the world's biggest professional association of endocrinologists. And we used tools that were developed by the Institute of Medicine and the World Health Organization to ask, to try and link specific chemicals and specific diseases to healthcare costs. I can go on at length about this. I can give you the reference if you want. But the bottom line here is this. On this side, we have the costs we estimated in terms of the health effect. So these are neurological effects. These are obesity and diabetes effects. This is premature birth. These are male reproductive effects. And on this side, we looked at the type of endocrine disrupting compound by class. And this one's pesticides. Then you have plastic, like bisphenol A, flame retardants, and then a collection of others. So we use simulation modeling to help us link those two, the health costs. Again, using, is that better? Yes, it's better. Using procedures from the Institute of Medicine. And the central tendency of this probabilistic estimate is that if you sum all these, it's costing Europe about 157 billion euros a year to deal with these healthcare costs. That's not trivial, okay? And if you look at it broken down by EDC type, by far, the biggest effect is through pesticide action and pesticide effects on IQ and lost productivity, okay? Now, I have a limitation to this study. We could perform this because of the stringency of the IOM's methodology. We could do fewer than 5% of the known EDC chemicals. So with just 5% of the known EDC chemicals, this number rises to 157 billion euros a year. And similarly, we were limited by the number of health conditions we could examine. We're currently performing this analysis in the US. The numbers are similar. We're not done yet. I can't tell you if they're a lot larger or a lot smaller. But the mixture of chemical exposures in the US is somewhat different from it is in Europe because of policy differences, and that's contributing to somewhat different patterns. I am confident, for example, that our estimate on the cost of obesity and obesity and diabetes, this is a way underestimate because the quality of the data currently available to do the calculations was insufficient for us to actually do some of the most obvious candidates. That number is going to be a lot bigger when we're done. Again, fewer than 5% of the chemicals yields big numbers. I'm going to give two more headline results. Question? Oh, I'm sorry. I'll be better. I'm going to give two more headline results just to pique your interest, I hope. How many remember Morgan Spurlock? Okay. And you remember what happened to him over that year of eating fast food? It was pretty ugly. It was a month. Okay. It was ugly. Yeah, a year he would have been dead. Well, just this past week, there's been lots of studies that have begun to help illuminate what were the mechanisms by which those health effects were produced. But it turns out just this past week, there was a study published, a serious epidemiological study published in Environmental Health Perspectives, showing that women who eat a lot of fast food, the more fast food you eat, the more phthalates you have in you. Phthalates are one of the classic endocrine disrupting compounds that interfere with masculine development, that interfere with adult weight, that promote type 2 diabetes. It's not a good thing. And so we're getting the science now, it's not done, but we're getting some insights as to how that vision translates into specific health effects. Okay, so the third headline is this. That's a fan. And I want you to think about this fan in this way. Here we've got disease of many types, water shortages, population growth, climate change, soil loss, biodiversity loss, toxification, materials expenditure, energy problems, economic issues. For the last couple of years, I've been working to try and ask the following. So each of these are forces that are changing what's happening to society, right? These are major forces unfolding on the planet today. We've been asking not what happens just in this blade or just in this blade or just in this blade. We've been asking, what are the interactions among them? And do they become force multipliers? Do they make things happen faster and harder? And I'll give you one example of what's come out of this exploration. If you look at these blades disease, soil loss, biodiversity loss, intoxication, and also economic stability. Here's the story. Roundup. Roundup has been planted over about 300 million acres in the Western Hemisphere in the last 20 years. Okay? Agriculture. After a few crop rotations, Roundup does two things. It sequesters nutrients in the soil, makes it less available to the plants, and it kills the soil microbiome. So what it does is it makes those 300 million acres totally addicted to chemical inputs to replace the fertility that Roundup destroyed. Okay? So toxification, that's a toxification effect on the soil microbiome and the biodiversity loss of the soil microbiome. How does the economy enter into this? The economists who are working with us tell us somewhere 3 years to 20 years from now, there's going to be a period of serious financial turbulence that may make it impossible for farmers to afford the chemical inputs. So all of a sudden, we transition from this time with 300 million acres planted to a technology based on Roundup to not being able to grow on those 300 million acres. That then sends a big signal into the international trade of agricultural products. Huge amounts of of protein and carbohydrates go from the Western Hemisphere to China every year. If we then disrupt that signal, it amplifies the societal turbulence that may be in front of us. And we only began to think about that because we were asking these questions about these interactions across the blades of the fan. Does that make sense? So I'm calling this you all have heard of ETA, estimated time of arrival, ETD, estimated time. This is ETB, externality time bomb. Okay? And we're concerned that there are going to be more externality time bombs as we dig more deeply into the interactions across the blades. So thank you.
Thank you, Pete. And thank you for calling out the issue of interconnectedness. I think that's incredibly important in the systems piece, so appreciate that. So we're now going to turn to Bob Martin, who's going to give us a very quick picture on meat and antibiotics. Bob.
Thank you. I really appreciate being here. Is the microphone close enough? Can you hear me? Okay, good. I direct the Food System Policy Program at Johns Hopkins Center for a Livable Future, but I've been trying to get the center to change my title to Meddling Generalist, because that's really what I like to do. I'm not a scientist. I'm not a public health professional. I am a political hack because I spent 30 years on and off Capitol Hill, and I've been warmly embraced by the public health people at Johns Hopkins. Before my current position, I led something called the Pew Commission on Industrial Farm Animal Production, which some of you may be familiar with. In 1945, Sir Alexander Fleming, the synthesizer of penicillin, won the Nobel Prize for his work. He had seen in his laboratory that the low-level application of antibiotics to bacteria created resistance in the bacteria that survived. In the early 50s, he was asked about putting low levels of antibiotics in the water supply to stave off disease in humans. And he said only an ignorant man would use low levels of antibiotics on a daily basis. And in fact, that is exactly the way most of the antibiotics are used in food animal production. The FDA estimates, it's not estimates, it's actually reported data. In 2011, 29 million tons of antibiotics were used in food animal production. That represented 80% of the total antibiotics sold in the United States. By 2013, that figure had gone up to 32 million tons of antibiotics. Many of the antibiotics are the same ones used in human medicine. And so what this shows is these antibiotics are used at daily low-level doses to compensate for the overcrowding, poor animal welfare conditions in these operations, and the environmental waste management problems. Animal waste is a nutrient that's important in crop rotation systems to nourish the soil when they're separated and housed in a barn or whether it's a pig or a broiler house. They become an environmental management problem. And so this system is really unsustainable in using these amounts of antibiotics daily. And I would say that if the current usage pattern does not change, it will increase the potential lethality of the meat we eat. And the reason why, as I said, many of the antibiotics are the same ones used in human medicine. And there are two types of uses of antibiotics in food animals. The therapeutic use, which no one objects to. That is, you have to treat a sick animal. And if there are several animals in a herd or in a flock, it makes sense to treat the entire herd or flock at a therapeutic level. But that is at a level high enough to kill the bacteria, but for a short duration. The problem becomes the non-therapeutic use, which is used, it's a growth promoter, which most companies say they won't do anymore. Now the FDA has allowed the term disease prevention, routine disease prevention. And it's interesting that most antibiotics that are labeled for growth promotion are also labeled for routine disease prevention. So a concern is that the industry will say, in recognition of public concerns, we're not using them for growth promotion, but the protocol and actual usage has not changed. And so what happens is these resistant bacteria leave the farm in a number of ways. They can obviously go out on the meat, on the animals, and contaminate the slaughter process, and still make it into the grocery store on meat. And we're talking about the bacteria, not really antibiotic residue. It can go out on people. The workers can carry it into their communities, and the resistant infections can spread. It can be in the environment, and that is a particular concern because nobody really understands fully what happens when antibiotic-resistant bacteria get into the environment in the water or in the soil. Bacteria are very prolific. Bacteria that aren't exposed to antibiotics can pick up resistance from bacteria that are resistant because they're not very picky about how they reproduce. And so it's a real serious problem that we're not really understanding very well in the environment. And so what is the real world impact of this? The CDC has said that there are 2 million infections a year in the United States. Now, these are all infections, not just related from animal contact or foodborne bacteria. 2 million infections in the United States, 23,000 deaths at a cost of $20 billion annually. The problem is even the CDC says that's woefully low, that they don't, it's a shame that they don't collect better data on infections in the clinical setting or on antibiotic animal use or animal infections. So they admit that it's probably underreported by at least a factor of 10. Worldwide, 10 million deaths are attributed to antibiotic resistance at a cost of $100 trillion annually. So, and some of the real world, other real world case studies about this, 100 trillion.
The global GDP is about 80 trillion.
Oh, that's the figure I've got from.
Maybe 100 billion. But anyway, go ahead. I'm sorry.
Yeah. It's okay. So there have been studies that have shown Campylobacter infections in Canada and the Netherlands tied directly to resistant bacteria in poultry. The University of Hong Kong has shown studies that resistant E. coli from chicken is directly causing bladder infections in women. Dr. Lance Price of George Washington University is replicating a study in the United States that I saw him last week, and he says will show the same thing, resistant E. coli on poultry consumed in the United States leading to bladder infections in women. There was a disturbing story out of China last week that a couple of infants had died from resistant bacteria that were resistant to the last antibiotic in the tool case, colistin. It had been mixed in animal feed with with ciprofloxacin, which is the second last antibiotic that to protect human health. And so it's like, well, okay, that's China, but as I said, bacteria are amazingly resilient, and they don't respect geographic or political boundaries. The Center for a Livable Future did a study that you might say, okay, well, I'm a vegan or a vegetarian, I don't eat meat. We did a study based on the Giesinger Health System in Pennsylvania that showed people living near swine spray fields. The disposal system for swine waste is you collect it in the lagoon, pump it out into a sprayer truck, and then you just go spray it on fields. The people living near those spray fields were 3 times more likely to have a MRSA infection than people not living near swine spray fields. We're also told to say things, to not be so negative and say things that are positive. I do think there's a couple good things on the horizon. There's something called the Commission on Antibiotic-Resistant Bacteria, CARB. The co-chairs are Dr. Martin Blazer and Dr. Lonnie King. Dr. Blazer wrote a book called Missing Microbes, which had a component of farm animal use. Dr. Lonnie King was a member of the Pew Commission before he went to CDC to run the Zoonotic Disease Office. And so they are recognizing the need for more funding to fight antibiotic-resistant issues, both in the clinical setting and especially in the ag sector. I think one of the real-world things you can do very easily is eat less meat. I read a study on the airplane on the ride out here that said China eats, is that my timer? Okay, China eats 60% more meat, this was in 2012, 60% more meat in 2012 than the world consumed in 1950. We slaughtered 1.4 billion pigs in 2012, 60 billion chickens, 1.2 billion rabbits, 2.9 million ducks, 296 million cattle, these are worldwide figures, and 535 million sheep and goats. The dietary guidelines for Americans in 2010 said that you should eat, the average consumption a day should be about 1.8 ounces of meat. The American Cancer Society says that 3 ounces of meat is a maximum daily intake, which is about the size of a pack of cards or the size of your iPhone. The average American eats 8.2 ounces of meat a day. So it's very easy to, I think, reduce the threat by reducing meat consumption. Make politicians aware of your concerns. Make them follow through on promises. Patronize restaurants and retail grocers that have a well-defined, stated, definable, and provable antibiotic use policy. So.
Great, thank you, Bob. That's fantastic. So we've seen a little snapshot into endocrine disruptors and meat and antibiotics. And I think, again, just to point to Pete's fan here, these are interconnected issues. We talk about them separately, and you can talk about the impacts and the solutions and everything separately, but actually they're incredibly mutually reinforcing in many negative ways. So let's keep that in mind. And so now I'm going to turn it over to Dick to talk about some of the strategies for change.
I went to medical school up the hill. And in my second year of medical school, is it okay? Closer? Wow. All right. In the second year of medical school, I was suffering from every single disease in the pathology textbook. And I ended up, I was worried about this, and I had this I must be MS. And then I heard about the psychiatric disorder. I said, oh, God, I'm cyclothymic. And, it was really a tough haul. And by my third year, I was in complete denial. And most physicians suffer from complete denial. And that's why we don't wash our hands enough, and it's hard to get us to testify and pay attention to things because it's the only way we can stay alive and get out of bed in the morning. I'm exaggerating, but not by a lot. I ended up doing my pediatric residency up the hill, and I remember working in the intensive care unit, and 1 week about this time of year in the nursery, they brought in a baby with gastroschisis, which is the failure of the abdominal cavity covering to close. Week later, another baby. The third one, another couple days later, all from the same area in the Central Valley. And senior nurse said to the attending physician, "Do you think they're using some chemicals out there that might be causing this?" And he said, he started to explain statistical randomness and Poisson distribution and how random things can cluster. And the next year I'm back in there, and I'm not exaggerating, 3 babies came in with neural tube defects, which failure of the closure of the spine, not full-blown anencephaly, because they wouldn't bother to tell you the truth, bring those children all the way up to San Francisco. And again, the whole explanation was this is randomness. Well, I grew up in New Jersey, so I was sure it was something in the environment, because when I was a kid, we used to see who could catch the most deformed tadpoles in an hour where I lived. Not exaggerating. So I did public health work at CDC and went to India and did smallpox and came back and became the doctor that did pesticides in the state health department. The state health department was in Berkeley at the time. And I loved it, and I got to go out in all these outbreaks. And we would have, this is back in the mid to late 70s, we would have 4, 5, 6 big outbreaks a year amongst farm workers, Maydill. Go into a field, and within a few minutes, they had blurry vision, sweating, became hot, were vomiting. Some of them would have seizures. We would have a couple of deaths a year in farm workers, a mixture of heat. And the average farm worker is getting 100 to 1,000 times the pesticide exposure. And we saw the photograph you had there, Judy, that the average consumer did. And I was in this long discussion with Cesar's own doctor, Marion, anyway. And she said, "Dick, you're too worried on what happens to middle-class people. You're a pediatrician. You're too worried about what happens to kids. The real people bearing the burden of pesticides are the farm workers." And I said, "Well, Marion, they are, but I can't get the well-fed, well-off people on the coast to really care about the farm workers that much." So I'm about the 3rd year there, and I get a call from the pediatrician who runs the intensive care nursery at UCLA. "Dick, we just brought in a child with tetramelia, and the mother had been exposed. She was a farm worker. She was picked up by the labor contractors and taken into the fields, and she just said that she became sick and was vomiting several times from the chemicals she was exposed to. And 1 week, she was about a month into pregnancy, she was exposed to brown powder and got sick. And another time, the chemical she was exposed to made her skin itch. And another one time, her eyes became swollen from it. And we had a person that could speak very good Spanish interview her and ask her, and she really didn't know what she was exposed to. She didn't even remember exactly which field. And, you know, there's a window for limb development. By the way, tetramelia is the absence of arms and legs. You don't need to be a dysmorphologist to pick out this defect. I mean, it's the most impressive thing you've ever seen. So we went down to the various farms and we asked, you know, what were you growing? I was growing grapes and tree fruit. And what did you use? Well, I don't have to tell you. Well, are there any records? Go away. And we had this terrible time trying to track down what was going on. So I went to the Department of Food and Agriculture. The Department of Food and Agriculture had all the pesticide data. They had shelves of toxicology data. The Health Department didn't have it. The Department of Agriculture had it. And each one of those chemicals had 5 shelf feet of data. No normal human being could plow through all the data on all the toxicology. And some of the data was phony anyway. I won't get into that whole discussion. And so I began to, and then I said, well, maybe we can measure what's in mom. Well, it was 9 months ago. That's not going to help very much. And we'll have to measure what's in the baby. That doesn't help very much. And to make a very long story short, and I'm now compressing 10 years of experience, finally, with the Academy of Pediatrics, we wrote a bill that said, fill the data gaps on pesticides. And Willie Brown from San Francisco, who was the head, double referred it to the Ag Committee and the Health Committee. The Health Committee passed it in 1 minute. The Ag Committee killed it. We had to come back the next year. Kaiser Permanente came up and testified on our behalf. The Academy of Pediatrics, California Medical Association, it got killed in the first committee, and by the third committee, when they brought in the baby with tetramelia, with 3 camera crews, it passed. So we finally had a law that said fill the data gaps on pesticides in California. And we began to really push for measuring children's exposure. And a wonderful person from San Francisco at NRDC named Lori Mott wrote a wonderful report on pesticides in the diets of infants and children that eventually led, although LR was one of the events, but also led to a whole Institute of Medicine study and led to the Food Quality Protection Act, the only environmental bill that passed, serious environmental health protection bill, in the last 30 years, 1996. A couple more things happened in California. I'll be very quick. One is we began, this came out of the awful cancer clusters in McFarland and Delano, was full reporting of pesticides. If you use chemicals, you're a farmer, you're a grower, you're a business person, you need to keep track of what you're using and where you're using it, and you need to report it. And you shouldn't be ashamed of it. You ought to be able to say what you're using. Number two, people have a right to know. So anybody can go and find out what's being used there. Three, we needed to have a birth defects monitoring program because cardiac defects are often, for example, in a newborn, not found in the first week or two. You don't sometimes see them for months, and then the child begins to show problems. So we needed a program to really track birth defects. And we had no cancer registry in the Central Valley. So we needed to have that as well, particularly in the ag growing areas. All of those things passed, and California is way ahead of the rest of the country in each one of those areas. The other thing we needed was measuring what was in people, and we call this biomonitoring. The way Pete knows that phthalates cause the distance between the anus and the penis in a little boy to shrink, which is evidence of estrogen exposures or anti-androgen exposures, was from the ability to measure phthalates in people. And so actually measuring what's in people is extraordinarily powerful and politically unpopular. So there's been real success. We've got huge challenges. More antibiotics are used in the chickens in North Carolina than in all the human beings in the United States. And it is a disgrace what's going on. I'm almost finished. The birth defects program turned out to be far more valuable than simply looking at pesticides because we learned a whole bunch of drugs actually reduce toxemia, reduce this defect, actually presented some other defects. Drugs ended up being, frankly, a deeper well for the scientists to drill into than pesticides because it's easier to get record keeping on drug use. But it's very important. And we actually looked at causes of gastroschisis and neural tube defects. But I want to give a couple big takeaways. Kids. Children are important. Children eat, drink, and breathe 3 times as much as adults do. So they are much more heavily exposed, and their dietary patterns are much different from adults a lot of the time. They live a lot longer to get sick after they're exposed than adults do. So there's a lot of reasons why focusing on children is important. Not only that, the public policy issue about the protection of the most vulnerable has enormous traction. 2, you got to fill the data gaps. Industry hates it, and they try and, I'm just going to say it, hiding data on things that people are exposed to is criminal, and you should not have to be a damn toxicologist chemist to buy food for your kids. And so right to know, and I know this is not, we're not eliminating something, we're just simply, you got to tell people very quickly. I happened to be able to be put on the committee that looked at Olestra. Olestra was this non-absorbable fat that tasted like fat, but went through your GI tract and pulled out actually vitamins A, D, E, and K, the fat-soluble vitamins. And so I think it was Procter & Gamble wanted to add vitamins A, D, E, and K along with the Olestra, give it to you in your potato chip. I won't name the brand. And I actually insisted that if they did that, they had to put on the label, contains Olestra, may cause anal leakage. Which they didn't like very much, and it was not a very good marketing tool, but people have a right to know. And by the way, that's true. It is true that it causes that. One more quick one is really important. Preemption. Preemption is a disaster. Every bit of environmental health progress we've ever made, I'm maybe exaggerating a little bit, but not by much, has come from an alert grandmother or a mother or a concerned citizen. I would bet 85% of the time it's a woman or a group of women that come together and say, there's something going on here. And they raised the alarm to the local doc, the county health department, and it really having a way to track what people are doing and then bring it forward. Think about that Flint, Michigan story, that pediatrician that stood up and said, this is terrible, you got to pay attention. I won't go to that one right now. When you think about other environmental public health successes, ADA, the American with Disabilities Act, started essentially in Berkeley, California, because of the disabilities functioning in Berkeley, spread to California, spread to the United States of America. Anti-tobacco efforts started in Berkeley, spread to other counties, and then anti-tobacco moved to the US and is now worldwide. You have to have somebody who's willing to go first. So Berkeley actually put a tax on sugar-sweetened beverages, and damn it, it's about time the rest of the United States steps up and starts doing it. Philadelphia's now talking about 3 cents an ounce on soft drinks. You can really afford another 30 cents. If you can afford $1.25 for a Coke, you can afford it. So what I mean by preemption is there's a lot of push to prevent localities from being more stringent than the state and to prevent the states from being more stringent from the feds. We'd still be stuck with smog in LA, burning people's eyes and planes not able to land if the federal government set all the environmental standards. California had to be, actually it was the LA district, but California had to be the lead on all of that. So focus on kids, focus on right to know, focus on blocking preemption, and my last quick one, because it really relates to the fan, is even though I'm desperately depressed sometimes, I'm glad I've got 2 beautiful grandchildren. And my hope is that the new generations have an ability to span data, to span information, to not be burrowed down into the details and be able to see the larger picture far more effectively than us leftover 20th century people can do. So with that, let me stop. Thank you.
Thanks, Dick. Can you hear me? Thank you, Dick, very much. So I was going to ask some questions of the panel, but I think I'm going to scrap that plan. We have half an hour left, and I've been able to. Yes, there are seats in here for those folks on the edges. If you want to come in and sit down, please welcome. So I'm going to scrap the plan because I get to chat. I have chatted with these guys, and you haven't, and. There's an incredible richness and wealth of experience and expertise up here. So what I would like to do is open the floor to questions or comments, and I think I've got folks assisting with the microphone. So this might be a little bit of a challenge given that our microphones aren't working perfectly.
Just remember to keep it close to your mouth.
Okay, that one works, and this one works. So we'll keep this up here. Let's keep that up here for the speakers, and then I'll hand this over.
First, I'd like to thank the speakers. Amazing knowledge and very inspiring. I want to make a comment and throw out a question on how we can move forward on an extremely important issue, building on what Pete said and also what Dick said as well. Drawing on my own personal experience, I'm Michael Antonio. I'm at King's College London School of Medicine. And one of my areas of research is in looking at mechanisms of low-dose pesticide toxicity. And we have begun focusing on glyphosate, Roundup, glyphosate-based herbicides such as Roundup. And basically, just to illustrate the point I'm trying to make, with glyphosate-based herbicides, the problem that we are faced with in getting the regulators to take note of potential toxicity from low-dose glyphosate exposure. And that is, if you just to illustrate that, there was a recent survey in Germany found glyphosate in the top 18 brands of beer. There was a survey of Californian wine, including organic wines, and all of them had glyphosate residues in them, some of them quite high again as well. When you put this data before the regulator, they say, yes, of course it's there because it's so widely used, but it's all well below what we say is safe. and therefore there's nothing to worry about. When you put before the regulator human urine analysis of glyphosate, they dismiss you on the same grounds that yes, you know, and we're conducting our own surveys actually of human urine, including in breastfeeding mothers as we speak. And the data we're getting, we put it before the regulators and they say, oh, nothing to worry about. It's well below what we consider to be safe. And that's, so what is that illustrating to us is that even with the evidence that we have at the moment, and we're building on it, we're trying to find out endocrine disruptive properties of glyphosate. Pete and I are co-authors on a paper highlighting the gaps in our knowledge of glyphosate-based herbicides that needs to be done, because at the moment, what we appear to be facing is that we don't have the weight of evidence to show harm based on real world levels of pesticide burden in the human population. And that gives, in a way, the excuse for the regulator to say nothing to worry about. So I feel, you know, we've got to fill the gap. One of the gaps I believe that are there that we need to fill, and we need to find a way of filling it quickly and effectively, because as time goes by, more and more people are getting sick and even dying, is to measure in established model systems the real world levels. We need to biomonitor more to find out what's in the human population, and we need to test those levels. What we find in humans, we need to test those and come up with causative links in controlled laboratory environments, linking therefore the data from the lab with the epidemiological data to get causative links. And I throw up this to the group and how we can move this forward to get really the regulator to sit up and take note. Thank you.
Michael, I'm just going to make is this on? Okay. I want to make a quick comment. When I was a medical student, the definition of lead...
Got to be closer.
This is really bad. When I was a med student, the definition of lead poisoning was a blood lead of 60. You actually had to almost have a seizure and be blind. The lead had to be so. And that was literally the definition of lead poisoning. Today, the point is 5. We thought the lowest possible lead level on planet Earth actually was a blood lead of 3 back around 20 years ago, and now the average baby is less than 3. Where am I going with this? What we have found as the overall population levels have dropped as we remove lead from paint and everywhere else as best we could, that levels we thought were benign were not. They robbed people of IQ. They robbed them of their lifetime of intelligence. You have earlier Alzheimer's if you have lead exposure earlier in life. Over and over again, things we were told were safe weren't. Same was true with Ordram, Bolero, a whole string of things, and probably all the organophosphates. I didn't do it.
Could I add something different to that? Excuse me. Could I add something different to that?
Yeah,
the dirty, dark secret of toxicological testing is it's all done at high doses. And we know that some of these compounds, particularly endocrine disrupting compounds, have effects at low doses that cannot be predicted by high dose testing. It's a huge issue, and we're pushing on it.
My name's Daphne Miller. I'm a family physician. I think one of the few physicians that's here today. And I really appreciate the fact that people who care about human health are here at this conference. My question to you is, whenever people from healthcare start to talk about agriculture, they always talk about toxicology. That seems to be the very comfortable place for us to come into the conversation. But in fact, when you look at what Tyler Norris put up there earlier in terms of our burden of chronic disease here in this country, most of it, in fact, is not from the toxins, but really from the fact that we have this system of disease that we're growing in terms of the types of nutrients and the crops that are out there. So my question to all of you is, how do we begin to engage in that conversation and don't just get closed into just a conversation about toxins, but really start to join the conversation about a health-giving agricultural system? How does that become part of the human health conversation? Thank you so much.
Yeah, can you hear me? No. Yes? Well, because of my political background, I'll take a stab at that. I think what's been highlighted earlier about starting small and growing is the way to go with that as well. California is a leader in agricultural production, and I think that if there's a lot of research going on now about crop rotation and integrating animals back in the cropping system to reduce the need for fertilizers and pesticides, I think that if you start, and there's a lot of that research going on in California, I think if you start in California and build is probably the way to go. The chairman of the Pew Commission was a former governor of Kansas, and he had a saying that I have appropriated, and that is politicians see the light when they begin to feel the heat. And I think that change in this case has to start locally.
Yeah, I appreciate your comment. It's really important that we take a broader view, but I would challenge you about the need to move away from toxicity. So as one example, I don't know if you're familiar with the now abundant research on what are called obesogens. These are chemicals, endocrine disrupting chemicals, that cause stem cells to become fat cells instead of bone cells. So if you're exposed to obesogens, you're more likely to become obese, and you're also pushed toward insulin resistance. So we have to take a comprehensive view, but we can't ignore these scientific realities. I'd love to talk to you afterwards because I don't think you were here for my talk.
And any one of these questions we could dig into for a whole day, I'm sure, and I would really like to get multiple questions from the floor. So, so I've got the woman in the purple sweater there next, and then Hans.
I'm Debbie Friedman, and I'm the executive director for GMO Science, which is a new research project gathering doctors and scientists together to explore the potential health impacts of genetically engineered food systems, including their pesticides. My question is for you. Actually, suppression of science has been a big issue that I've put a lot of time and energy into figuring out how to shift. And at UCLA, I'm just wondering what type of pushback you get working within the medical school there about even diving into the research connected to pesticides, especially from the biotech industry, and how that impacts your ability to do your work and others within the system.
So I was head of the National Center for Environmental Health at CDC, essentially the highest health and environment job in the United States for 9 years. When the Bush administration came in, I had 11 advisory committees, an overall advisory committee, and 10 others dealt with radiation, chemicals, a whole string of other things, childhood lead poisoning. The Bush administration fired 6 of the members of the childhood lead committee and gave me 4 doctors from the lead industry. Their total curriculum vitae was about this thick, and most of them were expert witnesses in various cases. This happened in multiple groups. They replaced the chairman of my advisory committee, who was the associate dean at Johns Hopkins, and gave me the vice president of the Heritage Foundation. So the level of political pressure has been enormous. I am deeply worried about what's going on with medical schools. I have written probably 20 recommendation letters for bright, brilliant, humanistic young people to go to medical school. I'm ashamed to say I have not gotten one of them in. They just don't want humanists, as far as I can tell. But the folks that want to make bioengineering and have 3 patents to their name and all the rest, and I'm seeing the medical centers going more and more after high-tech procedural medicine and further away from health. It's interesting, Kaiser Permanente is now starting at its own medical school and embracing primary care. It will open up in 2017. It will be in Southern California. But it's be such a shortage of primary care docs that are willing to deal with the patient as they are in the real world. This business, and I've been in these fights. I happen to be obsessed with urban planning as a health issue. Pete is the leader on obesogen and environmental endocrine disruptors. I've got other friends. I'll be at a meeting tomorrow on carbohydrates in the diet, we should not be fighting with each other. They're all additive. And I want to do a diagram someday that shows a human body that gets fatter as you stick in the obesogen and you stick in the high fructose corn sugar and you stick in the physical inactivity and too much screen time, because we're really the sum of all these negative parts. I want to say one more quick thing. There's a place called the Long Now Center, a block over here. If you ever read that book, The Clock of the Long Now by Stuart Brand, it's absolutely fascinating and it really captures some of this.
Great, thank you. Hold on, we've got Hans first, and then you, and then you. Hans first.
Thank you, Hans Herren. We have a lot of evidence that we can do without all these chemicals. We don't need them in agriculture. So why are they being used? I would like to hear, what your view is, what is standing in the way there? Because if we could not do it, there wouldn't be any organic food on the shelf, right? So again, I have some ideas about it. I'd like to get your view on what is the problem. Because you also mentioned about the media, the right to know. Okay, we know who is blocking some of this. But I think on the media side, we have a major problem also, because are those messages going out? As an example, where are the cameras? Do you see any van out there with the antenna way up there and broadcasting this meeting? So again, I think we need to figure out what is wrong. What is the problem here?
Well, my opinion, again, having worked on the political side, can you guys hear me? Okay. Not very well? How about this? Oh. It'd be like the American Idol symbol. We're doing a study right now. We have a very smart graduate student who's looking at political contributions to the different committee chairs and vice chairs based on different components of the Farm Bill. And in this last Farm Bill fight, sugar supports, and this is a very narrow aspect of this, right? Sugar supports were going to be eliminated from the Farm Bill in 2014. There are 3 states that raise sugar beets in the country. There are primarily 3 states: Minnesota, North Dakota, a little bit of Idaho, and some in the state of Washington. So 4 states. Fewer states raise sugar cane anymore. The sugar industry is the largest single lobbyist group in the country. They make the largest single number of campaign contributions. And guess what? Sugar's back in as a supported commodity. So I think the underlying problem, I was at a conference about a week ago, and the person said, the solution is we need to end the identity of corporations as people, which the Supreme Court has done. And they did, they approved it. We need to reverse that corporations are people too. I think that's right, but that'll probably happen immediately after money's out of politics.
Judy, did you have something you want to add?
So I don't think it's a mystery. I think it's corporate control of the industry globally. It's the consolidation of all the seed companies, agribusinesses. It's all one big lump. When we have Chem China and Syngenta, all these mergers that are happening, they're just consolidating power, and they're really running the show. And it's including the effect that they're having on science, on our land-grant colleges, and who's all these studies we're talking about doing and having more studies, those will be refuted by the land-grant colleges because they're seen as neutral, and they'll come in going, well, I don't know if that's really possible, blah, 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 blah. And they're also helping to shape the media messages. So here in the U.S., my parents grew up in rural South, subsistence farmers and sharecroppers. And there's people's sense of who's farming. It's the Grantland Rice photo. But the real farmers are mid-sized and very large. But we're having our politics and the political system around the plight of the family farmers. But all the resolutions are for big ag. They're not for these folks. And so it's all because, again, who's controlling the media, where the media message is coming from. It's all shaping it toward the answers that those of us who grew up in the 50s and 60s believed in better living through chemistry, right? We really believed in technology for everything. And we have this other extreme now of talking about agroecology, but it's a very different way of thinking. I don't know, maybe in Europe, maybe it's different, but in the United States, it's so deeply ingrained. We have to have a very serious level of conversations around corporate control, around who actually farms, who works the farms, who benefits, and what is neutral science. That's very complicated and also happen all at the same time.
Just real quick on that, and Dick jogged my memory. He just said that a company in China, Xinhua, bought Smithfield. So Smithfield is now a Chinese corporation. The largest meat company in the world is JBS. It's bought several meat companies in the United States. And so not to get too much in the weeds, but we have trade agreements that are pending before the Congress. And previous trade agreements would allow nations that felt aggrieved to go to the World Court and challenge U.S. policy. The current pending trade agreements would allow individual foreign corporations that don't like U.S. policy to go to the World Court and challenge us. We've never won a World Court argument. So it's very concerning when a Chinese company, if we decide to say you can't use non-therapeutic antibiotics in swine production, could challenge that domestic policy, and we would likely lose. So it's a really changing playing field.
Hi, I'm John Masaris of an Earth Group. We've been funding research on GMO-related pesticide. In particular, Michael Antonio's research. We've been funding some of his research. So I'm biased towards looking at toxicity. However, it is the case that there's very interesting subtle effects of nutritive deficiencies that result from industrial agriculture. For example, the fact that our whole food pyramid in the United States is on top of corn means that we have an imbalance omega-6, omega-3. I noticed in Peter's $157 billion estimate that 130 of it was neurologically related. I heard about a research study a few weeks ago in a prison here in California of dividing prisoners into two groups and giving omega-3 supplementation to half of them, and the other half got pills that looked exactly the same but didn't have the omega-3. And before they even had a chance to see, a change in their transcriptome or any other aspect of their microbiology, they noticed that the ones who were getting the omega-3 enrolled in 57% more coursework within the prison. There was a dramatic change in behavior. So there's interesting subtle effects. But the question I want to ask is it still true? I remember hearing years ago when I was thinking of becoming a doctor myself instead of turning into a physicist, that there was only one day of nutritional education in the American medical syllabus. That's how much exposure doctors got in the course of the multiple years of medical training. Is that still true? And is there anything being done about it?
John, when I was in training, we spent a fair amount of time talking. We spent the entire time, 99.9% of the time, talking about disease. I never learned anything about health the whole 4 years in med school, I guarantee you. You're nodding your head yes. And so, yeah, we did learn about B6 deficiency, B12 deficiency, pellagra, beriberi, on and on and on. We didn't learn about anything on the positive side of nutrition. There was maybe a day of it. It was desperately boring. And since we were in San Francisco, we went biking around Golden Gate Park. It's changed. And I would say a third of the public health students want to do something related to nutrition. At this point, there's been a complete sea change in the awareness. I want to just jump in with one more quick thing because I admit I'm kind of obsessed with built environment, and what I mean is, when I was born, the country was 140 million. It's now 340 million. The population of the planet is 4 times bigger than it was at the end of World War II. we've got to put people somewhere, and what we've done is we spread out across the best farmland in the world. So Salinas is paving itself over Alameda County, Orange County. They were all enormously. One of the most appalling examples is the Amish families north of Philadelphia, Bucks County. They're putting in these huge auction lots or fracking sites that, and the folks are selling it. And this is farmland. The topsoil's 60 feet thick, deep, and it's been used for 250 to 300 years, and it will not be used any longer. And this set-aside of the extraordinarily valuable resource for our great-great-great-grandchildren is just tragic.
So just time check. We've got about 8 minutes left. I've got 3 questions in the queue, and I see a few more. Maybe we can steal a few minutes of the break. I don't know if people are feeling like you would like to do that, but there's a ton of energy in this room, and I would love to take advantage of that. So I'm seeing a lot of nodding heads. Okay, so I've got 3 questions. I've got Harpinder and Michael. So let's try to get through those 5. Please be precise, and we'll try to have precise answers so we can get to all of them. You're next.
I'm Roger Wasson, and I've got a podcast called Farm to Table Talk. I have an antibiotics question, and I've heard from the veterinary schools that there's a difference in the antibiotics used, that some of them that are either more similar or the same class as those used for human treatment are more at risk, and that they're even more quickly abandoning those. And those antibiotics that are used in livestock feed that would still be used are the ones that are less likely to be similar to what would be used for humans. That's one part. The second part I'd like to jump on and answer real quickly too is that if we stop using antibiotics for growth promotion, as I think we should, and it's supposed to be happening, is there a way to require that be the case for the meat comes into the country, like JBS or the Chinese interests and so forth? Are they going to have to go by the same restrictions, and shouldn't they?
Well, yes, there would be a way to control that through trade agreements. We are in the process of trying to negotiate agreements on seafood importation. I think that most of the meat, I think we import a lot of seafood. The terrestrial animal production is mainly export, so we don't bring in an awful lot. It's one of the reasons why the North American Free Trade Agreement was a bit damaging, because now cattle move freely from Canada to U.S. and Mexico, and that's why something called country of origin labeling, which was to label the origin of the meat you were eating, was struck down in the World Court. That's the most recent thing we lost. I actually think that unless they're a public health vet, I'm always a little concerned about the vet's opinions, because the AVMA is underwritten by the pharmaceutical industry. All their meetings are paid for by the pharmaceutical industry. I think that tonnage figure I gave, when it's 80% of the antibiotics sold are used in food animal production. The Pew Charitable Trust has done a study of actually the antibiotics used in human medicine that are also used in animal production, and it was about 70% of that tonnage sold. So I don't believe they're really switching away from human antibiotics that fast. One of the things that the poultry industry is doing is using ionophores, which are not really, well, the Pew Commission addressed antimicrobial use, because we had an internal debate about whether ionophores were antibiotics or not. So we solved it by saying the non-therapeutic use of antimicrobials should be banned, so that would pull in ionophores that also take care of zinc, copper, gold, and other things that are used in Denmark, for example, as antimicrobials. So I don't think that reduction is really happening to a large degree.
Roger, when I was a med student up here, I remember the resident uncorking the ampule of penicillin. We were treating a baby with meningitis, and he said, "This stuff's great. I can just crack the ampule and the child is cured across the room." And it was a joke, but what he meant was the Neisseria meningitidis organism was so sensitive to penicillin that you were just, the single dose could do it. We're now in the 4th generation of antibiotics, these cephalosporins, well beyond ciprofloxacin, that, and it's it's a tragedy. And the other part of this is Big Pharma is not developing new antibiotics for humans at anywhere near the speed, which is another reason we really have to opt for prevention.
So the lady in the green scarf.
Thank you. Hi, Krista Essig. Previously at the CDC, at the National Center for Environmental Health. Thank you, Dick, for starting the Healthy Community Design Initiative. I helped to integrate the food systems issue into that.
It just got cut under the Obama administration.
That's terribly depressing. I didn't know that. Anyway, you keep delivering such wonderful news for us today, making me join you in your state of depression. But anyway, currently I am with Google running the Farm to Table program there and helping to try to educate how food is grown and why that matters to our constituents. And one of the biggest challenges I'm facing right now is which is widespread across all kinds of consumers, is confusion about the science and about what people should be eating and should I eat organic or should I not? And there's a big pushback, and there's I'm struggling big time, and I want to ask the panel how you feel we could be doing a better job at science translation and communications, bringing the science to the media in a clear way so consumers know what kind of choices to make.
So I have a little bit to add to that. At PAN, we're always in the middle. There's always these studies that are out there, and many of them totally seem to be in line with what we believe in already. But if they aren't peer-reviewed, we don't talk it up. There's a lot of the folks in the broader tent around our food and farm issues that we love. It could be a study with, 4 Swedes, but if it seems to be what we believe in, we'll talk it up. And so I think that part of it is on us to be much more rigorous about what we'll go out in front on. We don't need to have absolute proof of everything, but we need to kind of be clear on what it is that we're saying, because otherwise, if you watch shows like Dr. Oz, 1 month he'll be all over this new study and this new cure, and the next month he'll say exactly the opposite thing. And so people think, they throw up their hands. They just see debating scientists. We can only go so far in that because they can debate forever. So I think we try to have each of us have our own standards. We hold to it and we explain it. And we call out when we know that there are an agenda behind the science. We call out who's underwriting the scientific studies, who's talking things up and who's suppressing them. And we say to people, to some degree, these absolute proofs is not as important as the bigger picture that we know is true.
So I'd love to have a chance to talk with you about this. Just briefly, for the last 15 years, as Dick knows and Michael knows, we've run a program to work with scientists as their studies go toward publication and help them prepare for that process. So that, and then link them to journalists who have indicated interest in the subject of their studies. Been doing it once a month for 15 years and have driven hundreds of studies into the media in an informed way. We have a big board of scientists like Dick and Michael who help us sift through the wheat and the chaff and find out what's good and what's not, what's reliable, what fits in a context. And then we help the journalists understand what the context is, what the significance is, and maybe way down in the discussion, what were the materials and methods? Because journalists don't need to know that first. They need to know what the importance of the study is and its context.
I would also say we need that science translated to those who are procuring food for large institutions. They're also very confused about what to do. The Dirty Dozen doesn't cut it for them to be able to make their choices on what kind of food they're going to feed people. So I think that's another place we need translations. There's different audiences, right? There's the policymakers, the consumers, the buyers of the food, and we need to do better at it.
You know what I'm going to say. Don't you think the Google Foundation needs to put up a good lump of sum to really advance all of this?
I'm not hearing the strategies really emerge given the public health crisis. And so, and not just this panel, and I know how difficult it is. It's my life work too. But the rest of the conference, I'm not hearing the strategies commensurate with the problem either. So it just strikes me that these economists that say from 3 to 12 year or 3 to 20 years there's going to be a great disruption. We better learn a little bit more about that, because a true cost economy, in all likelihood, if we can't come up with these grander strategies that are commensurate with the problem and the timing of the problem, we're just going to have to use our good thinking to rebuild post-collapse. And you don't want to rebuild on the same model that got you in the crisis in the first place. So probably, practically speaking, the bulk of our work is laying out the seeds to rebuild post-collapse. So my question to Pete is just, what are the indicators these economists say to look for so we can gauge, is it more likely 3 or 20 years when this disruption happens?
I'm not an economist. I do work with economists. And they're very clear. That's what they say all the time. They're very clear. We do not know whether it's 3 or 20 because it's going to be triggered by human behavior. Some of the geopolitical things, we can predict those, but we cannot predict flips in human behavior. But one of the key things to be looking at in the economy is what's called credit productivity. They didn't like me saying that because that's their deep dark secret. Until about 1975, we collectively got something on the order of a dollar's worth of GDP growth from a dollar's worth of credit issued either by central banks or private banks. Now that's down to 10 to 15 cents per dollar of credit, 10 to 15 cents of GDP growth. And that's taking us perhaps inexorably towards a stage at which there will be no GDP growth with no matter how much credit you put forward. If you read the newspaper looking for signs like this now, you'll see mentioned, there's something in the New York Times today about declining debt or credit productivity. What that at some point is going to trigger is people's concluding they're not going to be repaid for the credit they're issuing or the loans that they're making. And that's what makes for big-time bank runs. So keep a watch on credit productivity as one of the crucial things. And let's see what happens the next time that a Greece or a Spain or one of these smaller countries has a problem, how the central bankers solve it, and how much closer does it take them to the point that they aren't able to, it reaches the point that what was too big to fail becomes too big to save.
So I'm going to try to get to the final 2 questions, and we'll just have to talk a little bit more loudly because I think the other sessions are wrapping up. I have Harpinder and then Michael.
Yeah, just quickly adding to the comment on the syllabus of med school, like sciences. Similar situation is in, I think, the agricultural sciences school as well, because the curriculum that is gone for the currently available for agricultural science graduate is the same. There is no emphasis at all on like what are the environmental impact, let alone the public health impact. So all agricultural sciences graduates, they come out of the system with absolutely no information, and they go out to sell those products, and they go out to work with those agribusiness companies with the information that, okay, this is the input-output system. More agrochemicals used, more output, and everybody will be happy. So it's not just med school syllabus issue, it's a universal problem. And not only ag science, but I think other science graduates also do not have any information or any knowledge about such issues. I think I would like to hear more from panel, like what can be done at the very higher level, at the education policy level, like how to incorporate these environmental health or public health issues into our education systems. Thank you.
I would just say initially that the Food and Water Watch has done a terrific overview or study of the funding of science at land-grant schools, and it's overwhelmingly funded by the industry to promote the status quo and the current business model. I do think that there is a growing interest in among some sectors that non-land grant schools should be able to compete with land grant schools for certain types of research on food production. So, but right now it's just overwhelmingly by the industry. And that gets back again, believe it or not, the land grant schools have a lobbying group, and it really is to promote the status quo.
Okay, last question to Michael, and then we'll wrap up.
Thank you very much. Again, perhaps a bit more of a comment than a question, but to finish on a positive note from me, I hope, as how political pressure can deliver at the end of the day if you are just keep hammering away. And first of all, I'd say that we were very grateful to Environmental Health Sciences when we published a paper last September. Which showed that a dose of Roundup in drinking water of rats, that is tens of thousands of times lower than what the regulator says is completely safe, over the long term still resulted in liver and kidney damage. Now you may say, well, did that shift the regulator? Well, probably not, because at the moment what we're faced with is that if you give them an organic food, which is pesticide free essentially, and a non-organic equivalent, which is laden with chemicals, they don't see that chemical burden as toxic. To them, they are equivalent. And that again is what the problem we're faced with, that what is there is not considered as toxic by the regulator. And the reason for that is what Pete said earlier, which is their science upon which they evaluate the toxicity of these chemicals is decades out of date, because they're ignoring potential low-dose toxicity, especially through endocrine disruptive mechanisms. Now, having said that, you may be aware that in Europe, in the last few days, the European Parliament voted on whether to relicense glyphosate use within the European Union. A ban was never on the cards, but what they voted on was, for us, very encouraging, which again shows how one can go forward. First, they recommended that relicensing should be only for 7 years rather than 15, and they recommended multiple restrictions in use, things that we could not have dreamt of even a few years ago. Yeah. And this has happened because of the pressure being put on the politicians within the union by various organizations. Now, unfortunately, this vote on the European Parliament is non-binding on the member states. Each member state can do what it wants. So what we're faced with probably is some countries will ban it, like France, whereas in the UK, which the UK government is a staunch supporter of chemicals and GMOs, we're likely to have no restrictions at all. But nevertheless, it gives you can see how if you keep at it, you can eventually get to a situation which is at least a good partial victory for us, if not a complete one. Thank you.
Thank you. So just in summary, 3 quick thoughts. Pick up on Michael's comment. Thank you for the segue to looking towards positive solutions. Maybe not enough were tabled today, but it is hard. But I encourage everybody to keep thinking about what has worked. Where do we need to find new solutions? So one thought. Second thought is I felt incredibly grateful for the energy and the interest and the enthusiasm here. And I would just encourage us all to keep that outrage alive while also trying to keep that positive energy going. Leading to my third point, and I want to just pick up on something Dick said, which is let's not be at odds with each other, but let's really try to find common ground to see where we can be mutually supportive in our work and try to figure this out and communicate what we need to communicate to create change. So huge round of applause for these amazing people up here. And thank you all for your very good questions and your insights, and hopefully we'll continue the conversation over the next 2 days and beyond.